Long time no see, or if you're new here, welcome. Wait, not welcome back. Welcome to my channel. Okay. Anyway, so today I'm going to be talking about antibody levels in the COVID vaccine and the study that I'm currently in. The John Hopkins study is testing people with chronic conditions or suppressed immune systems to see what their level of antibodies are for COVID. I did this, so I went already twice. I went 4 weeks after my first dose of Moderna, and then I went 4 weeks after my second dose. I do want to share those results with you all. What they're finding currently, they did release some information or research that they're receiving from one of their studies. This one was specifically with transplant patients, which, if you didn't know, I'm on CellCept, and that is a transplant medication, so I'm definitely interested. They found that less than 20% of those who were in the organ transplant study had COVID antibodies, so it was actually pretty low. This is for the first dose, and if you go on Reddit and such, you'll see that this is true for many. And I actually, after my first dose, found out that I had no antibodies. So I had produced no antibodies. I was pretty bummed. Of course, you don't want to hear that. They tell you that it's going to be less effective, but just like to think that I'm a little more protected than, you know, what it's supposed to be, I guess. So I was bummed about that. You know, of course I still was going to keep up with social distancing and masks and all of that, but it's still a bummer. Second time around, I went after 4 weeks and I found out that my number was 7.11 antibodies. Yeah, that's not many, because I was hearing from other people with lupus that they were having over 250. And yeah, so my number of antibodies is pretty low. They don't have data yet on what is an acceptable limit, so I can't say much on that, but I did want to share with you all what my numbers were looking like, because that's what I do on here. I share my experience and what I go through. So those were my results, and I hope that this is interesting to you. For context, I am on 400 milligrams of Plaquenil a day, and I am on 2,000 milligrams of CellCept per day. My guess is the CellCept did that, because I'm reading about it, and apparently this one is really, it's almost like it's blocking any antibodies from entering my body, but also I don't have very many white blood cells right now, so you know, that end is lower, so my immune system's not ready to go and be like, yeah, let's fight this. So there we go. That's it. That's all I have for this video. I will link the study below if it's still available. I believe it still is. I don't know if they're still accepting people, but it's worth a shot if you're interested. I hope you all are doing well. Please let me know in the comments below if you participated. What were your numbers? And yeah, would you do this study? All right, thank you all for watching, and I'll see you next time. Don't forget to subscribe, like this video, and hit that notification button. Bye.